Hi, everybody. Today we have with us Abhinav Krishnan from Oakland University, and he's going to talk to you about navigating through the med school application process. Thank you so much for being here with us. You can go ahead and take it away.
Fantastic. Hi everybody. Let's see. Did I get this going? Okay, cool. Sounds good. All right, so we've got a few people like already joining us today. That's great. So hi everybody. So my name is Abhinav Krishnan. I'm the Associate Dean of Admissions and Enrollment Management for Oakland University William Beaumont School of Medicine. Anyone from Michigan might know this, but obviously in the Midwest, I mean, the way that we look at this is like this is the state of Michigan. We're from basically a suburb of Michigan, which is a little bit north of like where Detroit is. So that's really where our medical school is. And today, what I'm going to be doing is kind of talking to all of you about something that I wish I had when I was going through the application process. My background is in cardiovascular physiology. So I did a slew of different things before I got into medical school. I didn't end up, obviously, if you look at my degrees, go to medical school eventually. I had a really, really like non-traditional pathway. And we can totally talk about that. As Priya just mentioned, I mean, certainly let's keep this casual. If you want to talk to me, go ahead and unmute at any time that you'd like. You could throw some questions in the chat as well. But honestly, as I said, I'm a very non-traditional sort of individual, if you will, and you'll get that from the presentation today as well. But that being said, when it comes to being non-traditional from an academic and a curricular standpoint, I didn't really know what I was doing with my life. I'll just be honest. I didn't know if this was the right path. Um, my parents like really had like very humble beginnings. We didn't have a lot of money. I always felt like I was a first generation college student, and like honestly, getting into school was kind of problematic. Like I was the kid that got into a lot of discord with a lot of my constituents and my friends. Um, Basically, a lot of a lot of activities that I would say that I kind of participated in wasn't necessarily going to lead me to medical school. And I think that trying to kind of figure out where I fit into the milieu of like medical school and like healthcare wasn't at all like my vantage point. And I think that navigating a path in which you'd like to kind of get towards there would have been really advantageous for somebody like me because I would have understood like, hey, maybe these are some of the things I need to consider if that is something that I can kind of if this is a pathway that I'd like to pursue. So I put together this sort of presentation that, as I said, is really like sort of informal, but it kind of covers like a lot of different aspects of the application process. And we'll go through the agenda in just a moment. You can kind of get a better idea of like what we have to kind of go with today. But before I begin, as I said, I kind of hail from Oakland University. Our mission, vision, values is a little different than a lot of other medical schools. Our values are really steeped in this idea where we were really new med school. We've been around for about 13 years. So we're kind of like, if you will, like a startup, and we're kind of scaling, if you will. And so, with that said, our founding dean had a really interesting idea. And he said that, well, there's a lot of medical schools out there that's committed to research or community service or innovation or, just clinical experiences. He said, of all these medical programs, I have yet to find one that has to do with compassion. So our mission at OUWB is to develop compassionate physicians who are dedicated to improving the health of their communities through collaboration and lifelong learning. Our vision is to really be a medical educator, or to really be a leader in medical education, I should say, strengthened by an innovative curriculum, commitment to diversity, equity, and inclusion, dedication to community engagement, and advancing research. And our values are collaboration, compassion, diversity, equity, inclusion, excellence, and professionalism. So those ideals have really kind of really been something that we've steeped along the way, just because we have a very interesting community that we serve. Here in the state of Michigan. So we have three distinct patient populations. So number one, we have the city of Detroit. We also have Flint. I don't know if anyone is familiar with the Flint water crisis that kind of sparked national interest. So we're the medical school that takes care of that community. And we also have an area called Pontiac. It's actually one of the oldest cities in the United States, and it was founded here, also in Michigan as well. So very, very interesting and vulnerable populations that we work with. So obviously, our mission, vision, values are kind of encapsulated under the themes of being able to help those types of communities go forward. So my agenda for today, I'm going to decode what I'd like to do first is kind of decode like for all of you how to go about this whole process. And I think a lot of that begins with what I just did, which was go through our mission, vision, values. So you all need to know that. So if you're going to go out, you're going to be applying to medical schools, you kind of need to know where you want to go, right? And obviously after that point, you need to also like start like developing an application portfolio to get you where you got to go. So we're going to start there. We're going to like look at what might be like a best fit sort of mechanism to find out different types of schools you might want to apply to. And then we're going to move into like creating your applications, like what you need to think about, what needs to be standing out in your application. So we'll go over that. The next big thing is, as I said, this was a big concern for me because budgeting for med school was a big deal. It is expensive. It does have costs associated with it, but there is a way for you to like still maintain access and understand that there are different routes, even from a budget standpoint, to get to medical school. So we'll talk about a little bit of those as well. Then I'm going to go over some briefly, just some interview strategies. Once you end up getting an interview invite, what you need to do and what you need to think about as you prepare. And then finally, we'll talk about choosing the right school for you at the very end. Okay. Any questions about this before I kind of move on? All right, cool. I'm keeping my chat open. So again, if you have any questions, let me know at any time. Okay. All right. So decoding the mission statements and finding the school for me. I think the first thing that I think I want everyone to sort of be aware of is like, what exactly is a medical school looking for? So I put together this slide a little bit about talking to all of you about what exactly is an admissions dean at a medical school really looking for when it comes to reviewing all of you. And when like now that I've sort of seen behind the curtain, if you will, about like how we like look at uh, various aspects of a student. I think honestly, it could be really condensed into these different types of items. So when you think about putting your application together, it's about showcasing all of these different ideals that I'm going to talk to you about right now. So, cultural competency. What have you done in your 4 years of undergrad to show me that you're culturally competent? Number two, excellence in scholarship. Number three, honor and integrity, social responsibility, accountability. Do you have communication skills? Can you show me grit and resilience? What types of leadership skills do you have? Can you be empathetic and understand what a patient might go through in case you one day end up having that privilege to like take care of a patient? Can you show altruism in some way, shape, or form? Are you self-reflective and are you self-aware? Everybody, what's the definition of insanity, right? So are you able to understand that, you don't want to necessarily continue making certain mistakes, and expecting different outcomes? And then finally, are you compassionate? So those are some of those things that we really look for in an applicant for pretty much, I would say, all medical schools. It's not really OUWB specific. It's something that I would say any admissions officer, if you're able to showcase these different things in the application, I think these variables like will really allow you to shine very deeply in the decision-making process for medical school. So towards that process, I mean, how are you going to decode the mission statement? This was a big problem for me, everybody. Like when I was going through the application process, I didn't even know where to get information. I was like, what do I even do? And yes, I was still applying like when the internet was still around and things like that. So in that process, how would I find that? What would I do? Where would I go to? And I hope that everyone is aware of what MSAR is. And if you don't, I want you to Google it if you can. If you just type in MSAR, you can immediately go to the medical school admissions requirement page. I've shown it's actually here on the bottom left image in the slide. And you can sign in and you can see some, like, I would say some peripheral information. So it'll talk to you about the school, it'll talk to you about like how much the school costs, it'll talk to you a little bit about what their admissions criteria might be, things like that. But all in all, if you're looking for a mission statement or if you're looking for honestly anything to do with medical school, go on the MSAR page and you'll find everything. There is a cost associated with it if you want like the full version of MSAR, but it is relatively affordable. And if you can't afford it too, you can always reach out to the AAMC to like let them know that you have some financial challenges, and you can go ahead and like they'll give you like access through another mechanism as well. So you'll have to contact them to kind of get that information. But those are some of those things that you can do in order to, like, as I said, get access to the system. And it'll show you everything. So as I said, it gives you not just curricular requirements, it'll tell you about interviewing, it'll tell you about COVID-19 restrictions that are sort of ebbing away now, or at least completely ebbing away, and various other aspects of every institution that you'd like to apply for. So that's, I would say, one area that you can go and see. Another one is the school's websites themselves. Especially here in Florida, there's various medical schools that you can apply to. One of them, for example, is University of Miami Miller School of Medicine. And there's so many others that are around the area as well that you can also apply for as well. And a great way of doing that is just logging in and then just typing, like, for example, University of Miami Miller School of Medicine admissions, and it'll take you to a landing page. Here in the very bottom right image, I did that for OUWB. So for our medical school in Michigan, if you type in OUWB admissions, this web page pops up. And you can go through the whole web page and it'll talk to you about admissions requirements. It'll talk to you about what you need to think about as you go through, like, as I said, the decision-making process to getting into medical school, and also allowing us to pass the vibe check, right? We want to actually make sure that, like, we're a good fit for each other too. And you can kind of get a taste of, like, our culture and what we're all about through our web pages too. Finally, the last part that I'll talk about here is your third-party websites. There's also places like Student Doctor Network. I've abbreviated that here SDN. Again, Student Doctor Network. And that'll give you, like, a lot of, I would say, student specific information. It's actually completely monitored outside of the medical school and outside of it, institutional administrative oversight, I would say. And it's really managed by all of you, the students. And so all of you collectively get together and you guys all jump on Student Doctor Network, and you basically put under various medical schools what you're thinking about our medical programs, helping each other out, talking about when secondary invites go out, talking about when interview invites go out, and even when offers go out as well. So thinking about, like, certainly think about that as you go about your decision making on collecting information and doing your brainstorming on getting, like, mission statements or any preliminary information about medical school. Savvy Pre-Med and Reddit are also pretty, like, useful as well to try to just get a lot of that preliminary information. But remember this, a lot of those third-party websites, a lot of, I would say, third-party friends or anybody else that you're talking to, they're not necessarily coming from, like, the mothership, if you will. So if you're really looking for, like, correct and succinct information that's really going to help you, contact us directly. We all have, like, emails that you can reach out to us at. I'll put ours in the chat. It's medadmit at oakland.edu. And you can reach out to us and ask us general questions about, okay, well, what's your application process look like and things like that. And obviously, those questions aren't intended to be advising sessions. And a lot of medical schools, I would say nationally, are really kind of, I think, transferring and kind of forwarding students over to pre-health advisors at different schools. So certainly at FSU, like, you want to make sure that you are kind of, like, looking at that as well, and identifying different pre-health advisors to kind of get you where you got to go, and that'll go, as I said, a long way into helping you determine what medical schools might be a good fit. Any questions about that before I move forward? All right, cool. Sounds good. Again, if you have any questions, as I said, I'm just here to kind of just, like, as I said, give you some information as we move forward. So the next thing that I wanted to talk to everyone about was decoding that mission statement. So now that you've collected the information from MSAR or any other resource, what do you do now? And I think a really important part of all of our admissions processes in medical schools has to do with the idea that your mission statement really drives what you do, right? So from the mission statement, now that you've identified it, now how do you figure out what you like and what you don't like? So there's a few themes that I think is, like, pretty reoccurring that you could look at that could frame the theme of a personal statement or even a secondary essay as well. So number one, you can look for themes of service, research, primary care, equity, innovation. It could be rural-based medicine. It could be wilderness medicine. There's all kinds of, like, different types of themes that occur. So take a look at that and just see what those themes are before you begin your writing and thinking about the medical school too. Next, I would say study the school's clinical partners and the surrounding community. As I just mentioned to you when I opened, our medical school, for example, at OUWB, we have one clinical partner. There's a previous medical school that I used to be affiliated with that had 14 clinical partners. There's some medical schools that I'm aware of that have clinical partners, not just like around the area, but somewhere in different states. So keep that in mind as you go about your decision making too, that sometimes getting access to these medical schools are like really convenient, but they're also going to be maybe things to consider as you begin to make your decisions on what school to go to, based on the fact that you could be doing a clerkship, for example, which is when you actually get into the clinic typically after your first and second year. And after you're in the hospital, you could be driving from your home, which could be 5 minutes away, maybe somewhere that could be 30 minutes away, and maybe somewhere that could be several hours away, or even across state lines. So remember that. That could be a big part of your decision making on which medical school might be the right fit. Next, asking what kind of physician is the school trying to train? Another thing that I mentioned to all of you is the reason why our school was founded. Our school was founded at least at Oakland, and it's not in Oakland, California. It's in Oakland, Michigan, in Rochester, Michigan, I should say. Um, but the kind of physician we're trying to train is a compassionate physician. So, for example, when the pandemic went out, one of the things that we were really kind of like really focused on was this idea of um, medical ethics, especially when it related to things like ventilators. So one of the pillars that we have was, how do we like, and this is what we do when we teach our medical students was decision making. And how would you decide between giving a ventilator to, for example, a 3-year-old versus giving a ventilator to someone who's like maybe a 70-year-old patient? Who would you give it to when you only had two decisions to make? And what is the ethical decision? What is not the ethical decision? And how do you go about making further decisions like that as you go about your clinical care? So those types of questions and things like that is what we're really steeped at OUWB. We're all about how do you think and how do you act and how do you execute, as a physician. And so I think those are some of those things that we kind of expand on. But a lot of other medical schools also do their own flavors of those as well. So keep that in mind as you go through that mission statement. Next, choosing the right school. So a lot of things to kind of consider, but using those resources like we talked about, compare things like curriculum style, support structures, advising. One caveat to our advising structure is that we have two full-time mental health counselors for all of our medical students. So they're just people that they're outside of the curriculum, they're outside of administration. You could just go to them and say, listen, like, I just had a really rough week. I got into a car accident on Thursday. I had a huge exam on Friday. And I really I missed lunch or breakfast on Saturday morning. I'm just feeling really down. Like, you know, let's talk it out. And so that's really cool because it's actually that a lot of medical schools are sort of they have a lot of tentacles in main campus. And so oftentimes you're forwarded to the main campuses of different schools. At certain schools, those types of resources are actually in-house. So those could be also something like advantageous as you begin to think about your next steps as well. And in addition, obviously consider location, cost, culture, wellness resources like we just talked about. Ask what types of clinical exposures you'll have. As I just mentioned in our school, for example, the patient populations that you're going to work with. We have the highest rates of preterm birth in the country. We have a very predominantly large African American population, as well as a large Hispanic population too. And how do you go about taking care of those distinct populations? And by the way, we have the third. We have the largest Middle Eastern population outside the Middle East, also in the state of Michigan. So that's a huge deal too. So from looking at these demographics, how do you work with these different types of patient populations? How do you break cultural barriers? How do you take care of individuals, especially if they do have skepticism for the field that you're actually coming from, right? So those are those things that we end up teaching you and how to actually get to where you got to go. And a lot of medical schools do that. So those are some of those things that you need to ask questions about. Also, break time. Are you going to be able to like relax and actually go on like, spring break? I have medical students, for example, that want to get married. They found the love of their lives. They're like, you know what, Dr. Christian, I really want to go ahead and like, do I have time to like actually get married in my second or even third year, maybe even my freshman year. We have medical students that also have children that come into medical school, which is a big deal. How do you take care of that? Does your school provide resources? Our school is like providing like daycare support for our medical students so that they can actually like take care of their kids and actually come to school. So do those things happen? Like those are things that you need to consider. Another thing also is like student support structures, like step prep, which is our board exams for a medical student. They take steps one, two, and three. So you finish your first and second year. Step one is between second and third, and then step two is right after that, and then step three is after graduation. So those are some of those things that you need to kind of think about as you go through school. Areas of improvement, ask them like what are some areas of improvement you have, like don't necessarily like directly reach out to someone saying, what exactly are the negatives of like your institution specifically, but I think areas of improvement are great, right? I think it's a good way to kind of like gauge whether or not the institution is self-aware themselves, right? What are some of the things that you're working on? So those are things that I think you can kind of consider. And then finally, revisit the mission of these schools between your offers. So after you go through your application, your interview, and you're finally getting offers for admission, you might get a few, right? You might get five, you might get six. But how do you differentiate? How do you figure that out? So those are kind of those things that you need to think about as you go through. So revisit those missions to see like where you're really interested in. A lot of medical students or prospective students will reach out to me, like, for example, even now, in like April and say, hey, listen, I really appreciate your time, but, unfortunately, there's another medical school closer to me that just gave me the offer, or it's my dream school. This is where I've always wanted to go. And for us, that's fine. The thing is, it's more important to us for you to go somewhere that speaks to you than for you to go somewhere just because you just want to go. The thing is, wherever you go, we're going to teach you like things like, okay, this is a cell. This is the nucleus in the cell, and there's DNA in the nucleus. There's only so many ways I can teach you that, right? So it's the clinical exposures, it's the environment. It's also about getting out there and just doing things differently, right? So much of the time, I feel like we're so interested in kind of like, just being with the familiar. And I think like it's important for us to get outside of the box sometimes and like engage with other people, look at different types of schools and kind of check out what might be a little different, make new friends, and really kind of like push yourself into kind of doing something different. So those are those things that I think could really, really build you and really build your mindset and also build your personal statement. So this is a good segue for me for the next topic, which is crafting standout applications and a great personal statement. So, as we kind of just talked about, I think like being able to talk about your journey and talk about who you are is really, really important. But I would say, like, before we get to that personal statement, I think it's important for you to just be a well-rounded candidate. So if you see the image to the right here, these are all the pre-professional attributes that the AAM or the AAMC suggests that you have before you apply. A good way to kind of note this is that as you begin to list off all of the experiences that you have, think back to this pre-professional checklist. Do you have service orientation, social skills? How are you going to show that, whether it be in your interview or elsewhere? Cultural competency, teamwork, ethical responsibility to self and others, reliability, resilience and adaptability, capacity for improvement. How do you show that, right? And all of these other caveats, right? Academics, clinical exposure, service, so on. So keep that in mind. Like having all of these things is what makes a well-rounded applicant, not just one of those things. And I know that for all of the students that are on the call today, and I'm with you on all of this. It's academics is hard. I call it the social determinants of life. Life throws a lot of things at you. Many of you have jobs. Many of you have like, difficult family situations. Um, so on and so forth. It's like everyone is different. Everyone brings something to the table, which is really the way that we look at diversity, equity, and inclusion. It's this idea that everyone has it. Like there isn't a single student that can tell me that they don't have something to like offer to like towards that. You all have an experience. You all have like a unique set of attributes. And that's what we're all seeing. And that's what medical schools are shifting. And that's the way that we're viewing things, right? Obviously, all of you have heard so much about changes that are happening at the federal, national, like state levels. And the thing is, like, what we do is like we really haven't changed very much, at least in the state of Michigan. We look at things from a very, very equitable standard, and we want to make sure that all of you are like equally reviewed in our application processes. And that's what I want you all to like understand because I feel like there's a lot of students that feel like, well, because I don't have something, it means that I can't apply. And that's what we're trying to do a better job of, right? What we're trying to do is make sure that everybody has a chance to get to where they have to go. And that's something that we've been very, very committed to. So keep that in mind as you go through. And that's where you have like the opportunity to showcase a really, really the special circumstances and the special experiences that you've had that have brought you to medical school and applying to our medical programs. So keep that in mind as you go through your application process. Now, next, we also have personal statements, right? Like we talked a little bit about this earlier. But the thing is, you're going to be answering one of two questions: why medicine and why you? So take a moment to focus in on that. Focus on those moments that, that change how you think. And it's not just like a resume recap. It's something that, why did this happen? And the fact that like all of your experiences wasn't a checklist. You're not going through like your entire application saying, "Oh, I've done clinical experiences." Check. Volunteer experiences. Check. "Oh, I've got 3,000 hours of this type of work." Check. What does that mean? And I want everyone to realize that, right? When you put your applications together, you have to like note how much time you spent on a given experience. What is the difference, everyone, between like 200 hours and 203 hours? Is there a difference between 300 and 400? Is there a difference perhaps between 10 and 3,000? Probably, maybe. But I think that the same way all of you would view that is the same way we would view it. And I want everyone to realize that. Like, I spent a lot of time when I was putting my application together where I felt that putting my application together really was a chore. It was something where I was like, I don't know. I mean, maybe, and I think maybe some of you suffer from this too, like I did, where I was overthinking everything. I was like, oh man, I spent 4 years or 5 years in a research lab just to make sure that I got one letter of recommendation. And I was like, oh man, I mean, I need to do this. I need to make sure I just get that. Whereas I completely missed the ball. I missed the point of why I was getting that letter. That letter was supposed to say that I had received like a certain degree of experience when it comes to critical thinking, from analysis, working with a lab group, figuring out like complicated answers to complicated questions. And that I could have gotten from like 1, 2, 3 years even. And the fact that I spent even more time there was great for me, but it wasn't something necessary for an application to med school. And I want all of you to remember that. Like one thing, if I can leave you with in this presentation, and I say this to all of my students, which is your time is billable, each and every one of you. And if you looked at time as the idea that 1 hour of your time is equal to, let's say, $5,000, is it worth your time to do whatever activity you're thinking about for 3 hours? Like, is it worth it? And that's the way I view like a lot of these applications too. Like, if you look at that and you start making better decisions for yourself, this is where you begin to like feel like much more of an adult and I don't know, just take ownership of like the whole process, right? And again, sometimes you have successes and sometimes you have failures, but it's about identifying the failure and getting past it, right? Like medicine is all about that. We're always revisiting what we're doing. We're always like evolving our frame of thought. Maybe we can always do it better, right? That continuous quality improvement. That's what medicine is about. And so as you're continually trying to improve and get better, um, it's safe to say that we want that reflection in you. So keep that in mind as you put your personal statements together, right? Show maturity, show a service mindset, and also tie in all of those experiences together. And more than anything, try to avoid a few things: activity dumping, service without any reflection, imagery. Like, I mean, I can't tell you how many personal statements I read where the applicant begins to personify themselves as like the squirrel. The squirrel is something here, and then the acorn happens to be medical school, and so on and so forth, right? The thing is, like, I appreciate um, as I said, the personification of things, but certainly, like, the other part of this too is that I want to hear what you have to say. So sometimes what I say is like focus on your point. Like get to your point, get to where you got to go, and I think you'll be just fine. All right, moving forward, budgeting for med school. This is a big deal. And as I mentioned earlier, I know like there's a lot of people out there that may not necessarily know what you can and cannot do. One of the items that I didn't note on the slide that I want to mention to everybody is called the Fee Assistance Program. I'm going to put this in the chat, FAP. The fee assistance program is huge. And I didn't learn about this until I was going through my applications already. But if you do meet a certain income threshold, you can ask the AAMC, and specifically an AMCAS, I should say, um, to just type in FAP AMCAS, and it'll give you all of the information about how you can go ahead and put an application together to waive all of the fees associated with applying to medical school. This includes your primary application fee, your secondary application fees, which could be like thousands of dollars. So keep that in mind. I think that's a really, really good way of showing that. And we also get little indicators saying that you were an FAP recipient as well. And it also earmarks you likely for a lot of need-based scholarships that also many institutions provide to you. So keep that in mind. But here's another thing. So planning for tuition, fees, living costs, all of this stuff, right? As I said, social determinants of life. There's a lot of things you got to prepare for. But there's ways like the fee assistance program that you can use in order to like try to alleviate some of the financial burden you might have in order to access med school. The convenience that all of you have right now is that virtual interviews are here to stay for at least the most part now. There's a lot more of a push towards trying to get you all back to our campuses, but there's a huge cost deterrent there. And I think following 2020 and the pandemic, we kind of shifted away from that. So we're really heavily involved in like looking at virtual interviews as our process. So that being said, that alleviates a lot of the barriers when it comes to a hotel fee, travel fees, food fees, like just for that whole process. And you could just like from the comfort of your living room really zoom into an interview, which is pretty cool. But one thing that I want everyone to be aware of here on the call is this thing called cost of attendance. It doesn't matter if you're a borrower. It doesn't matter if you're, um, if you know that you can have your medical school covered by any other means, you should know what this means. Okay. COA or cost of attendance exists at every school. So, for example, if you typed in, and I'm putting this in the chat, OUWB COA, you would get into a website where you could click on a link that'll show you this Excel spreadsheet. This Excel spreadsheet, let's go over it just really quickly. I think this would be incredibly beneficial for you as you go through school. So, and begin to the application process, I should say. So you can see here, there's a few different types of expenses that we predict that you might have. Some if you're living on campus, some that you're living off campus, some that you might be having also when you're living off campus with your parents, for example, too. All medical schools are really putting this together. So if you type any school and you type COA, you'll get it. So first of all is your tuition. How much is your tuition per year? The next one is living expenses. How much is going to be your living expenses for that year as well? And that is your tuition and fees. That's it. So when you get a scholarship, actually, before I get to that, so this is your, like, as I said, your tuition and fees. The rest of this is what we know, what we call as your cost of attendance. So this tuition and fees plus all of these equal your full cost of attendance, 90,646. Okay. Now at OUWB, the tuition for us, this is a little higher. One thing that we do is my job at the medical school is to make sure that I give you guys the lowest amount of debt possible when you leave. So we're actually one of the lowest, not only in the state, but in the country when it comes to debt. So that's not reflected here in the tuition. So that's another question to ask your schools. How much scholarships do you provide? We, while we're in partnership with Oakland University, which is a public school, we're largely fiscally private. So we don't really get a lot of state appropriations from Michigan, which allows us to like package students faster. It allows us to get scholarships out to you faster because we're not really like handcuffed by any red tape. We're able to do the things we need to and give more extra support and funding to our medical students than the typical school. But certainly it comes with disadvantages too, because one thing we have to make sure we rely on is a lot of external funding to make sure we maintain resources, whereas a lot of other public schools don't have to do that. So that being said, coming back over here, the thing I want all of you to be aware of is that when you get a scholarship, everybody, your scholarship does not address your 90,000. Your scholarship goes to this, your billable items, 83,246. So all of this other cost of attendance, which could be a certain amount, a sizable amount, is a little higher. And I want everyone to be aware of a few things. Now, here, for example, loan fees for the incoming M1 that's coming in this fall has gone down to zero because this type of loan has now gone away from the federal government. So something to remember. Whereas for my M2s, they're still grandfathered in. So they have that ability of capturing that type of low interest loan. For a lot of other students right now, for if you're in grad school, you're going to be taking out an unsubsidized loan. And this is where I'm coming to next. You have to understand the types of loans you're eligible for. Largely across the United States, this July, there's a whole change that's happening where access to anything over an unsubsidized loan limit used to go through Grad Plus loans, which was basically an interest rate that would be between, so your unsubsidized loan would be maybe 7%. Your Grad Plus loans used to be like 9%. And they could be a little higher just depending on a few other variables, but typically it's about 9%. Now, that type of inequity used to be there between unsubsidized loans and your Grad Plus loans. Your unsubsidized loans were pretty much capped at a certain amount towards your tuition. So you weren't really, I'm sorry, it was capped at a certain amount based on your institution and like what your overall like tuition structures would be. So typically you would make it would be like a loan limit of like, let's say like 40K or so, right? And it would typically be, as I said, like at your tuition amount. Anything in excess of that would come to like, as I said, your cost of attendance calculations. So if you would take out an additional loan, or if you needed to go above the tuition amount, which many people do, right? If you want to pay for books, course materials, your car, living expenses, things like that, you would take out a Grad Plus loan to like take out the difference. So that's what we used to be able to do. But now what we've done is that we've increased the unsubsidized loan limits to 50,000. So for example, my tuition charge um, used to be a little bit lower than that, right? I'm sorry. So it's like a little bit higher here, as you can see with my 63,000. So what you would have to do is you would have to take a private loan for the difference of what that would look like. So before it would be, as I said, up to tuition. Now, because the Grad Plus loan limits have kind of, or Grad Plus loans have gone away, unsubsidized loans are capped at this tuition amount. So what you're are at $50,000. So what you're going to have to do now is go to a private loan lender and get additional private loans to go above that amount. And every medical school around the country are working with different private lenders to figure that out, whether it be Sally Mae, Citizens Bank, or anything like that. So we're in the process of working that out. We have a really cool tool here at Oakland called ELM Select that allows you to like look at different private loan borrowers and then get like as I said, where you need to go. And I can put that in a chat well as well so that you can get an idea of like what I'm kind of talking about. But the ELM Select tool is like the easiest way for you to like go ahead and get that information. And once I'm done with the presentation, I could throw the actual link in the chat for you as well. All right, I'm going to be speeding up just a little bit from here on forward so we can get to some questions. So interview strategies, obviously know your story, motivation, challenges, growth, and values. Use simple sentence structures as you go through your interview. You don't want it to be like too rehearsed in some ways. While you do have to be like sort of, you should practice interviewing and practice talking about yourself. Sometimes just making sure that you can enunciate words properly and then just speak from the heart about who you are and what brings you to the table. I think that's going to make the world of difference for you, like as you go about your interviews. So keep that in mind, and certainly demonstrate your professionalism, your empathy, and also your curiosity as well. And then finally, above all else, research the school. There's oftentimes students that may talk about other schools and programs at other schools that may not necessarily fit with the school that you're applying to. So keep that in mind. And I don't have necessarily a slide for final decisions in school selection, but I do want everyone to note that when it comes to like identifying the schools that you want to, um, we're not the NFL draft. We're not looking for an all-star linebacker or anybody else. We're looking for people to take care of the communities that we serve. And we want to find that, those application materials, they're not a checklist for you. Like we want to make sure that when you're putting your applications together, that it's a way of life for you, that going to take care of other people in the hospital is something you would do on a regular basis. It's who you are and it's what's in your soul, right? And I think that that's the most important thing. And if you're able to show that to us, then any trial and tribulation that could happen, you can pass it, you know, um, with flying colors. And I think that that's like a really, really important thing to remember. So keep that in mind as you go about finding the schools that you want to apply to, interviewing at the schools that you want to apply to, and then finally deciding on the best fit for you. And with that said, I think that kind of brings me towards the end of my webinar for all of you. And so happy to take some questions and kind of like talk to you about anything that we talked about today. I'm an open book, so yeah, looking forward to like seeing all of you or hearing from you.
Thank you so much for sharing all of that. I know that was very
Mhm,
helpful for me and for advising students as well. And students, if you have any questions, now's the time to ask.
mhm.
Okay, so we do have a question. Do you
Yeah.
receive applications from non-traditional students, and is that common?
Yeah, so that's becoming increasingly common. So there's a lot of non-traditional students that are applying these days. And what that means is that it's the student that sometimes takes a major like political science, for example, and does like another career path, and they come back to medicine at a later time. So we do see a lot of those types of students coming in. Along the vein of that, we're also seeing a lot of students coming in with gap years as well. So if it takes you time, that's okay. I think there's been a lot of consideration that's happening in the undergraduate level. So this is all, so there's a lot of conversations happening where it used to be about 120 credits to get an undergraduate degree. There's a lot of schools that are now thinking, what if we shorten that to 90 credits? If you look at countries like Germany, France, Italy, like even Asian countries as well, you go to medical school directly after high school. So it limits the amount of time that you're in school, it limits your debt burden. So we're really cognizant of that, and we're kind of looking at those types of strategies. But certainly at any point in time, if you're in a different career path and you're coming to medical school, we're ready for you. And that's definitely something that we're seeing an uptick of.
Thank you. And then we had another question as well. For an international student, what additional things can they do while applying for medical school?
I would say doing the same things that you're doing like in any other for like as any other student would. So it's like clinical exposures, volunteering and research, keeping your grades up. I know for international students, it has gotten a little more difficult and challenging. So I think that that's something to kind of just be aware of, just that sometimes don't be disheartened. I think that there's a lot of medical schools, mine included, that are really committed to still like viewing like international applicants. Um, and I think like, there are some, as I said, rules and regulations that have gone forward with certain schools that have kind of prevented them from accepting international students. But by no means has that changed like your decision making on how you put your materials together and what you need to continue doing when you're applying to school. Continue doing all of those things and excelling in them. And that's all I would say that you would really need to do in order to get into medical school. But just make sure that you understand, though, that they are looking at you sometimes as a separate cohort. There are there is a view that's different from like the regular admitted student. But I don't know. I always used to look at that as like, you know what? We get to see you for all that you have. So if you have like a really like great application, then you know for sure I'm going to review it. So keep that in mind. And all the international applicants that we've reviewed in the time that I've been at my medical school, we've loved them. They're fantastic. I just think that there's a lot of medical schools out there that are a little worried about matching, for example, after medical school, just given a lot of the changes in like visa regulations and things like that. So just keep that in mind, but don't be disheartened. We still like love international applicants that apply to our medical programs.
Thank you so much. And then we also had another question. What clinical experiences do you want to see, and what clubs do you expect students to be a part of?
Ooh, clinical experiences I want to see anything that has to do with you touching a patient and you getting something out of it. So I don't necessarily like it where it's like a student. You could do any clinical exposure to me, and it would still mean nothing to me if you didn't gain something from it. I see applications all day that talk to me about, oh, I shadowed this physician, and they'll list all their shadowing exposures with nothing to gain. It'll just be like, well, I observed them. Sounds good. And even in the interview, I'll ask them, like, so it seems like you had a lot of like shadowing opportunities, and did you learn anything from it? And they'll say, yeah, I mean, I got to shadow the physician. I thought it was like really interesting. Yeah, those aren't the question or the answers that I'm looking for, right? I want to know that when you went there, you learned about like you saw a difficult patient, or you went there and you saw how there was a physician that was working for 36 hours before they saw you. I want to hear about, okay, well, you went there and you learned about how a physician has to work with a nurse, has to work with the PA, and figure out the best ways to go ahead and manage care that way for the patient. And I want you to see how much effort like that goes into it, right? Like a lot of people won't realize how much work it takes until you're actually in medical school, to be honest. But I want you to have an idea, and that's the clinical exposures that I expect. So the number of hours that exist with that, I mean, how many, I'll probably flip that back, right? How many hours do you think you need to show me that shows me that you actually have the experiences that you need? And remember, it's kind of like an iceberg, right? So it's like I want depth of experiences. I don't just want like, this acute experience that's coming in that's short term. I like long-term experiences with depth. So learn from it and then do it for a long time.
Thank
I hope
you.
that's
And
helpful.
then
Yeah.
that is definitely helpful. And then another student was asking, they know that's recommended the primary application is submitted as early as possible. What would you say is the latest that you can reasonably submit it?
I would say like as long as like there's an application deadline, you're good. Everybody, remember this. Everyone is like freaked out for so many years about all of these like application deadlines that are coming in. I think you said it best in your comment. It is recommended that it's submitted early as possible. The key word there being recommended. Do not submit your application unless you're ready to submit that application. I want to see, it's kind of like you playing your greatest hits, everybody. I don't want to see an application that's coming in from anybody that you haven't put your best foot forward. If you could have waited an extra week or two or even a month to get it where it needs to be, then wait the time. If you need to wait even for another cycle, I know that's hard to hear. Wait the next cycle. Because what I'm going to do is I'm going to benchmark you against yourself the next year, and you better hope that I like see a significant improvement for the following year, right? I want to make sure that you guys have like done it that much better. And remember, we only have so many positions and so many seats. And the more you engage with our admissions offices, the more we're going to engage with you. But it's also the same thing about like on all of you. Put your stuff together only when you're ready to like go ahead and submit. So I would say when it comes to time, for example, at OUWB, you can apply at any time from the cycle opening in May all the way through our cycle ending in November 15th. Even if you submitted it on November 14th, I'm going to review it the same way. The only disadvantage that comes in is that I would have been giving interview invitations from August all the way through probably February, January, Feb. And even that, there's a lot of considerations we're having about even shortening that timeline. So the number of offers of interview invites, right, that we have available to us will decline over time. That doesn't mean that necessarily you wouldn't be reviewed. It just means that the number of available interviews that we might have might diminish over time. So that's all. So reasonably, as long as it's done by the application deadline, I think you'll still be okay. But earlier the better.
Thank you. And then a student was asking, when you talk about non-traditional students, does that include post-bac and master students that come to medical school? And is their application viewed a different way?
Yes. So does that include? Not necessarily. So it depends. So let me give everyone the caveats here. So if you're a non-traditional student, for example, right? So let's say Dr. Krishnan is, and um, I'm a police officer. But when I was doing my education, I got a degree in biochemistry before I became a police officer. Okay, which is possible. But now I'm like, you know what? After about a year or two, I kind of want to like go through my calling and I want to go to medical school. I There really isn't, I would say, a lot of medical schools that I'm aware of that have a statute of limitations about your curriculum. You can go back. And that would include someone who then does not have a post-bac or a master's degree. You would be a non-traditional student. However, there are some police officers, for example, I'm just using that as a good example, who may have done a political science degree or a criminal justice degree before they became a law enforcement officer. And because of that, because they didn't take any pre-med courses, they may have to go back and do post-bac or do a master's degree to showcase to us that they have that. It could also be that they might have to just like do it because of not just because they have their pre-med courses that they haven't taken or prereqs, they have to do that. They may do it because of the fact that they have like the medical schools themselves could have a statute of limitations that says, well, you've been out of school for so long, and if you're a non-traditional student, we need a year's worth of courses before you apply. Um, so it could be a variety of those things that could push a non-traditional student to take postbac or master's degree coursework, but it's not exclusive to non-traditional students that they might have either or. So I hope that's the best. I think that's the best way to answer your question. So I hope that helps.
Thank
And oh,
you.
by the way, and is the application viewed another way? It's not viewed another way. A non-traditional student would be viewed as anybody else. The same thing with your postbac and your master students. They're all viewed the same. It's just that they're different types of grades that we have, right? So if you're a master's student, you would have an undergraduate GPA and a master's GPA. And if this was high and this was high, I would say, oh, that sounds great. If this was low and this was high, I would say, okay, that's great too. And some of us have those types of credits too. So if you do poorly in undergrad and you do well in your postbac and your master's based on certain number of credits, and at OUWB it's 24 credits. If you have a certain amount, we will look at that GPA over this. But if you're low and low, for example, it might not go your way. So that we do for all students that might come through our admissions process.
Perfect. Thank
Sorry,
you.
Priya, go ahead.
No,
Yep.
you're good. We just have a lot of questions. So another student was asking, if they have a clinical experience where a doctor isn't compassionate with the patient, can they mention that in their application, something that they still learned from and that they would not do, or should they only mention good examples of things that they learned?
I think that's a fantastic question. And I think it's important to realize that in any occupation you go to, there's ups and downs, right? I think it's important to realize that and like to appreciate that. But I think in your application, I want you to just play your greatest hits. There's no need to kind of talk about necessarily this is what I don't want to do, which is why I'm doing it. Because the thing is, none of you are physicians, right? So it's not like you're necessarily coming into a job and saying something like, well, like this is why I do it this way. But rather, you're looking to try to get into a profession. And what you're trying to do is understand that there are good things and bad things that do exist everywhere. And what you're committed to is always being like above all of that and trying to do the best job that you can. And that's the key. It's about showing like you can do the best job that you can, and be the physician that you're meant to be. And say that I would say like what you could just say is that you saw challenges and that there are difficulties that physicians experience. But you understand that there are ways to get around that and to appreciate the fact that challenges exist and create some adjuvants to figure out how to like go around that and to become better than that. That's the way to do that, right? It's the self-improvement, self-awareness, and being able to showcase, as I said, your greatest hits and your greatest strengths. So focus on that. It's not necessarily about good examples. It's about understanding that there are challenges and that you can overcome those challenges with whatever skill sets you have.
Thank you. And then we had another question about MCAT. So
Mhm.
students have heard that MCAT results get sent to all the medical schools and all of their previous attempts get sent. Is that accurate?
Yes. So we'll get all attempts. Yep.
And then how would you view an experience being a medical scribe at the ER where they don't touch patients, but they have documented?
I think if you're a scribe, I think that's fantastic. I think getting clinical exposures is getting harder and harder. There's a lot of medicals like clinics that are just closing up shop to external student opportunities and student experiences and exposures. So I would say if you're a scribe and you have like I'll even call it this way, the luck of becoming a scribe. I think that's great. And I think that you're able to like understand what the patients are going through and how they're going and doing the things that they're doing. And it's a type of clinical exposure, I would say. But obviously the ones that I enjoy the most are the ones where you get to interact with the patient. It takes a full team to like work with patients and get to where you need to be, right? So showing us like, I mean, even like mid-level providers, like you worked with the PA, you worked with the nurse, you worked with all these people. It shows to us that you understand the ecosystem and you understand what healthcare looks like. Being a physician is being a leader, right? It's about knowing that like you have such an important stake in the patient's like health and their longevity and like making sure that you understand all the components that need to exist in order to get them where they have to go. But those components are all fundamental for a physician to be able to do those things. So yeah, I think even if you are a scribe and you're viewing things from a peripheral standpoint, it's still beneficial. I just think that like there are still like other opportunities perhaps for you to like try to get more involved, but if that's the best that you can do, that's still great. That's still considered clinical exposures to us.
Thank you so much. And then the last question we have is, can you give an example of hands-on type experience?
Yeah, sure. So, working as medical assistant, I would say working with doing clinical research. I think that's a big one. Doing consent forums, admitting patients that way. Um, Shadowing, I think, is also kind of helpful. You can sometimes get like a lot of like hands-on experiences from just doing that as well. So those might be like different types of like exposures that might get you more hands-on exposures and experiences.
Thank you so much, and thank you so much for being here today. We really appreciate it.